Okay. Again. Good evening, everybody. Apologies, the internet seems to be a little bit unstable this evening. What I want to talk to you about is some regulation. I'm particularly pleased to talk to you the day after the International Day of the Midwife. It was a very special day, and I would actually say that probably was the highlight of my week. I think it's always a very special day, but I think maybe people really pushed out yesterday. We all were wearing yellow and trying to feel joyous in this very difficult time. And it was a very different day because the world continues to face these challenges of COVID-19 to our practice and to the women and newborn babies in our care. And what I want to say at this point is the NMC, the Nursing and Midwifery Council of the UK, absolutely recognises the important role and contribution that all midwives and student midwives are playing at this time, and we want to thank you. So as a result of the COVID-19 pandemic, a Coronavirus Act of 2020 made some amendments to our order, and the NMC worked with government and stakeholders to put in place particular measures for nurses, midwives and nursing associates, as well as nursing and midwifery students. I will just say at this point, there are some conditions for people who join the temporary register, and one of that is that they have to work under the direction of an NMC registered nurse, midwife or other healthcare professional who's not on a temporary register. So the temporary register is about trying to get more people into practice and making it more straightforward for them to do so. Obviously, we have to be assured that they are fit to do so, and it is only a temporary register, and it will fall when legislation dictates that the emergency is over. So some of the normal registration requirements don't apply, and one of them is they don't need to have satisfied revalidation requirements or pay a fee, but they absolutely have to follow our code while they're on the register. And we can remove individuals or groups from that temporary register. And the sort of registrants we were looking for were people who'd left the register up to 3 years ago and 4 to 5 years ago, but did exclude anybody who had any FTP concerns. And one of the other things that we did was that overseas nurses and midwives who had undertaken the online test but we're just waiting to sit the OSCE in order to join our full register, we're also given the opportunity to join the temporary register. So what this did really was raise the number of registrants available to support our NHS and our social care system during this crisis. We also did some further measures. So at the moment there is some flexibility in relation to revalidation and retention on the register, as well as fitness to practice hearings and appeal hearings being online. So there's been a number of things that's tried to reduce the burden of some of the things that we have to do within our statute. The other thing we did, which was a major part of this work, was to look at our programme standards for our programmes of nursing and midwifery. And obviously this evening I want to particularly talk about those for midwifery students. And the aim for this was the educational institutions who are approved by us to run our programmes, together with their practice learning partners, we wanted to give them much greater flexibility to enable the final year students, so those are the students in their final 6 months, to be in practice. However, there are some key principles during this period that student midwives will continue as student midwives. So we want them to be supervised, And I've had a lot of conversations with people about what it is to directly or indirectly supervise students, because we recognise these students are in a very critical period of their programme, and they've already got a lot of skills and proficiencies, and they're not far off becoming registered. So they need to develop that confidence as well as their competence. So while they're being supported by their practice supervisor, they perhaps don't need so much direct supervision, but they also are going to come across things that they absolutely need full support and be directly supervised in terms of the care they're giving to women and babies. And our fundamental principle that during this time they continue as students, meeting their competence, developing their midwifery skills, and using their practice assessment documentation. But one key change is that they're not supernumerary. And some of this has been part of the restrictions and requirements because they will be paid during this time. But whilst not being supernumerary, they will have protected learning time, and some of them will still need to complete their theoretical components. But our absolute ambition is that they will register as a midwife on time, whilst contributing so much to the maternity services. So the reason we wanted them to do this, and one of the things we asked them to do, is that they could be in practice for this final 6 months. And so we removed the requirement for them to have this 50-50 split between their practice and their theory. And so we recognised that it meant that they possibly would have more time in practice than 50% than they would have done before this crisis. And of course, all their learning outcomes need to be met. So there's been a lot of work looking at what placements these students need. And I will just say at this point is that whilst we recognise the value of these students continuing on their programme, as well as the contribution they're going to make, we had to be very clear that this was an individual decision. Because for some students, it wasn't possible for their own personal reasons or their personal health for them to actually be in placement at this time. Protected learning time was a very key principle, and it was important that the students still got the support and the supervision to carry on learning during this period. And so this term protected learning time recognises that there should be opportunities made for them to learn while they're undertaking this final placement. The other thing that we also had to consider, because that was the third years, and then the second years will also have the opportunity to be in practice from our point of view, although I'm sure Nicky will come on to talk to them about perhaps some of the challenges the second years, perhaps that has to be considered. But we had to think about the first year students who perhaps had very little, if any, practice time at the moment. They needed a lot of support, and that could have been challenging for our practice supervisors at this time. So one of our emergency standards was to ensure that first years continued on the programme, but they would spend 100% of their time in academic learning. That doesn't preclude them doing voluntary paid work or perhaps being maternity support workers, as they would have done anyway, but none of that can be counted towards their pre-registration programme. So they are 100% in theory in terms of their programme. The other change that we made in 2018 was to our supervision and assessment standards. And interestingly, a lot of midwifery programmes, although they haven't adopted the new, haven't had their new programmes approved for the new programme standards, which were launched last autumn, many had actually already adopted these new standards. So we made this an emergency standard, so anybody who had not gone through that process with their programmes could adopt those standards. And the reason for doing this is the fundamental difference with these standards for supervision and assessment is it gives the opportunity for any registered or healthcare professional to supervise midwifery students, where that hadn't been the case with our earlier standards. So again, these emergency standards try to give much more flexibility to supporting students on their programme during this time. The other thing that is a slight change is in the new standards of supervision, we've been very clear that a different person must supervise the student to the person who assesses them. And that was through our quality assurance feedback that we needed to make those two roles quite distinct. But for the period of time this emergency standards is in place, exceptionally, the same person may fulfill this practice and supervisor and practice assessor role. And again, we wanted to remove the additional burden on the workforce at this time, while still ensuring appropriate support and assessment of our students. So to all of our students, I wanted to thank you for those of you who have actually taken up this extended placement, whether you be in the 3rd year or the 2nd year. We are absolutely committed to you continuing on the programme. We want you to complete as near on time as possible, whilst you're still making an important contribution to maternity services. But for those of you who were not able to opt in, we also fully understand that decision. It was right for you and your own personal circumstances, and just be reassured that you will return to practice in due course and get every support to become the midwives of the future. So I'll just thank you at that point, and I think, Sue, we're going to come back to questions.
Yes, we are. Thank you very much, Jacqui.
Thanks for watching this video from the Maternity and Midwifery Forum. For more expert opinion and analysis, hit the button below to subscribe.